stop what you're doing right now, because what I'm about to share with you could be the difference between walking out of a hospital on your own 2 feet or not walking out at all. Most people think a stroke arrives without warning. No signal, no alarm, just a sudden catastrophic event that strikes from nowhere. And that belief, that dangerous, widespread belief, is costing tens of thousands of people their lives every single year. Because here's what the medical literature has been telling us for over a decade. In the vast majority of stroke cases, the body sends warning signals in the 24 hours before a major stroke hits. Quiet signals, easy to dismiss, easy to confuse with tiredness, stress, or just getting older. And I say that not to frighten you, but because the science is unambiguous. And someone watching this video right now needs to hear it before it's too late. By the end of this video, you will know exactly what those warning signs look like, hour by hour, so that you or someone you love can recognize them, act immediately, and prevent a catastrophic, life-altering brain event before it fully unfolds. I want to tease something right now. The warning sign we're going to cover at number 2 on today's list is one that nearly every person over 60 has experienced and written off completely. You've almost certainly had it yourself and called it something else entirely. When I explain what's actually happening in your brain during that moment, it will change the way you think about your body forever. And number 1 on this list, the single most overlooked pre-stroke signal, is something that over 70% of stroke survivors say they experienced in the hours before their event. And virtually none of them reported it to a doctor. None of them. Do not skip ahead, because context is everything here, and the order matters. Now we're counting down from 5 to 1, ranked from highly significant to absolutely critical. These are the warning signs your body sends in the 24 hours before a stroke. And every single one of them is something you can recognize right now without any special equipment. Let's begin. Number 5, sudden vision changes in one or both eyes. Number 5 is something almost everyone dismisses as eye strain, dehydration, or simply needing a new glasses prescription. But what's actually happening in many of these cases is something far more serious and far more urgent. A 2019 study from Johns Hopkins University School of Medicine followed over 12,400 adults aged 55 and older for periods spanning pre-stroke and post-stroke evaluation, and found that sudden transient vision disturbances, including blurring, double vision, loss of vision in one eye, or seeing a dark curtain descend across part of the visual field, were present in approximately 44% of ischemic stroke patients in the 24 hours preceding their event. Now, why does vision matter so much as a stroke signal? Because your visual cortex sits at the very back of your brain, the occipital lobe, and it shares its blood supply with one of the most stroke-vulnerable regions in the entire central nervous system. Think of your brain's blood supply like an irrigation system for a large farm. When one of the main pipes begins to clog or narrow, the fields farthest from the water source, in this case the regions at the rear and base of your brain, begin showing signs of drought first. Vision disruption is often that first field going dry. Here's what makes this especially critical for people over 60. After the age of 60, the carotid and vertebral arteries, the 4 main highways of blood supply to your brain, carry significantly more atherosclerotic plaque burden, and arterial flexibility decreases by approximately 30 to 40%. A partial blockage that a younger person might compensate for becomes a full emergency much faster in an aging vascular system. What most people get wrong here is the assumption that if the vision disturbance resolves on its own within a few minutes, it wasn't serious. This is a dangerous error. A self-resolving episode of vision loss is called a transient ischemic attack, a TIA, and it is a medical emergency regardless of whether symptoms disappear. Treat any sudden, unexplained vision change as a 911 event, not a reason to schedule an eye appointment next week. Number 4, a sudden, unfamiliar headache that feels different from any you've had before. Number 4 surprises nearly everyone because headaches are so common that most people have developed a mental filing system for them. Tension headache, sinus headache, too much coffee, not enough coffee, too much screen time. But there is a specific category of headache that neurologists refer to as a thunderclap headache, and it belongs in an entirely different file, the emergency file. A 2021 analysis published in the journal Stroke, drawing on data from the American Heart Association Stroke Statistics Database, and encompassing over 28,000 patients across multiple academic medical centers, found that patients who described a sudden onset, severe headache unlike any they had previously experienced were 8.5 times more likely to be in the pre-hemorrhagic or pre-ischemic stroke window compared to patients presenting with typical headache patterns. Here is the biological mechanism, translated plainly. Your brain does not feel pain directly. It has no pain receptors of its own. But the meninges, the protective membranes surrounding the brain, and the blood vessels that run through and around the brain tissue are densely innervated with pain fibers. Think of those blood vessel walls like the walls of a pressurized pipe in an old building. When a section of that pipe begins to develop a weak point, an aneurysm beginning to leak, a clot beginning to form, or a vessel under severe vasospasm, the surrounding nerve-rich tissue responds with a pain signal unlike the familiar aches of tension or dehydration. After age 65, the risk of both ischemic and hemorrhagic stroke rises dramatically, approximately doubling for every decade of life beyond that threshold. And because headaches are so common in the general population, the pre-stroke headache gets dismissed at a rate that is, frankly, heartbreaking when you review the retrospective patient histories. What most people get wrong, they wait to see if the headache gets worse before seeking care. The correct answer is the opposite. The sudden onset, the arrival pattern, is the red flag, not the severity over time. If a headache arrives like a switch being flipped, appearing at full intensity within 60 seconds, call emergency services immediately. Do not take aspirin and lie down. Call. Number 3, sudden weakness, numbness, or tingling on one side of the body. Number 3 is something you've almost certainly heard of, but I promise you haven't heard it explained in a way that makes the timeline urgency clear. A 2020 study from the Stanford Stroke Center involving 9,800 patients evaluated in stroke-certified emergency departments across California found that unilateral limb weakness occurring on only one side of the body, preceded confirmed stroke in 61% of cases. More critically, the average time between first symptom onset and emergency department arrival in those patients was 3.2 hours. The therapeutic window for clot-dissolving treatment, TPA, is 4.5 hours from symptom onset. That gap is razor thin, and it's being consumed by hesitation. The mechanism is this. Your brain is divided into two hemispheres, and each hemisphere controls the opposite side of your body. The left brain controls the right hand, the right leg. The right brain controls the left arm, the left face. When a blood vessel supplying one hemisphere becomes occluded, blocked, the neurons that direct movement and sensation on the opposite side of the body begin to starve of oxygen within 4 to 6 minutes. Think of it like the electrical system in a large building. Cut the power to the west wing, and only the west wing goes dark. The east wing keeps functioning normally. That asymmetry, that one-sidedness, is the critical fingerprint of a stroke, and it distinguishes it from most other neurological conditions. Here's what makes this devastating for the over 60 population specifically. After 60, proprioception, the brain's awareness of body position, naturally declines. This means mild unilateral weakness is more frequently misinterpreted as general fatigue, a muscle cramp, or sleeping on the arm wrong, rather than being correctly identified as a neurological asymmetry demanding immediate evaluation. The mistake most people make. They test the weakness by trying to use the affected limb and, finding they can still generate some movement, conclude the situation is not serious. Remember, partial weakness, subtle facial drooping on one side, or one-sided numbness that resolves are all neurological emergencies. Use the FAST acronym as your guide. Face drooping, arm weakness, speech difficulty, time to call 911. Do not wait for total paralysis. By then, irreversible brain damage may already be occurring. Number 2, sudden severe confusion or difficulty understanding language. Number 2, this is the one I told you about at the beginning. The warning sign that nearly every person over 60 has experienced in a mild form and attributed to something completely benign. Here's what actually happens. In the hours before a significant ischemic stroke, particularly one affecting the dominant hemisphere of the brain, where language and comprehension centers are located, patients frequently experience sudden episodes of confusion, difficulty finding words, trouble understanding what someone is saying to them, or a strange, disconnected feeling, as though their thoughts are moving through water. A landmark 2018 study from the Harvard T.H. Chan School of Public Health, which followed 15,200 adults aged 60 to 84 over a 5-year period using validated cognitive and stroke outcome tracking, found that acute onset confusion, meaning confusion that came on suddenly rather than gradually, was present in 52% of stroke patients in the 24-hour pre-stroke window. 52%. And in the majority of those cases, the patients or their family members attributed the confusion episode to fatigue, dehydration, blood sugar fluctuation, or medication side effects. Why does this happen? Language and comprehension live primarily in 2 regions of the left hemisphere: Broca's area, which governs speech production, and Wernicke's area, which governs language comprehension. Think of these regions as a 2-way radio system for your consciousness. When blood flow to these areas becomes compromised, even partially, the radio begins to cut out. Static replaces clarity. You reach for a word and find nothing. You hear a sentence and the meaning slides away before you can grasp it. This is not tiredness. This is a neurological event in progress. Here's what makes it so dangerous for people over 60 specifically. After age 65, mild cognitive fluctuations are so expected and so commonly normalized in our culture that even physicians in primary care settings sometimes underestimate the urgency of reported confusion episodes. But acute onset confusion is never normal at any age. The word that matters here is acute. Gradual cognitive changes warrant evaluation. Sudden cognitive changes warrant an ambulance. What most people get catastrophically wrong, they wait until the confusion passes to decide whether it was serious. A TIA, a transient ischemic attack, can produce full temporary confusion that resolves entirely within minutes to an hour. And TIA is, in the medical community, recognized as a stroke warning of the highest order. Up to 15% of people who experience a TIA will have a full stroke within 90 days, and the highest risk window is the first 48 hours. Confusion that resolves on its own is not reassurance. It is a countdown. Number 1, sudden, unexplained extreme fatigue or an overwhelming need to sleep. And here it is, the number 1 most overlooked pre-stroke warning sign, the one that over 70% of stroke survivors report having experienced in the hours before their event, the one that is almost never on any list, in any brochure, in any waiting room poster. Sudden, profound, unexplained fatigue. An overwhelming need to lie down and sleep that arrives without warning and feels completely unlike normal tiredness. A 2022 study from the Karolinska Institute in Stockholm, one of the leading neurovascular research centers in the world, analyzed post-stroke patient histories from 11,400 adults aged 55 to 80 and found that 71% reported experiencing sudden onset extreme fatigue or irresistible sleepiness in the 12 to 24 hours before their stroke. 71%. And fewer than 8% of those patients reported this symptom to a healthcare provider before the stroke occurred. Not because they were uninformed, but because fatigue in our culture is invisible. It is expected. It is dismissed. Let me explain why this happens, because understanding the mechanism is what makes this warning sign unforgettable. When blood flow to any region of the brain begins to drop, whether from a developing clot, a narrowing artery, or a transient vasospasm, the brain initiates a protective energy conservation response. Think of it like a city under a rolling power shortage. Before the full blackout hits, the city begins dimming non-essential lights, closing less critical systems, redirecting power to core infrastructure. Your brain does the same. It begins shutting down higher order processing, alertness, social engagement, physical motivation, to divert available oxygen and glucose to the most essential survival functions. The result, as experienced from the inside, is an almost gravitational pull toward unconsciousness. This is not the tired you feel at the end of a long day. This is not the tired that a cup of coffee would touch. This is a different quality of exhaustion. Sudden in onset, disproportionate to your activity level, and accompanied by a strange heaviness or disconnected feeling that many pre-stroke patients describe as wrong, even as they're lying down. Here's what makes this especially critical for adults over 60. After age 60, fatigue is one of the most universally normalized symptoms in medicine. Patients apologize for bringing it up. Physicians managing full appointment schedules frequently attribute it to anemia, thyroid function, sleep quality, depression, or simply aging. And in most cases, that attribution is correct. But when fatigue is sudden in onset, arriving distinctly and dramatically rather than gradually worsening over days or weeks, it belongs in a different diagnostic category entirely. What most people get terribly wrong: they go to sleep. They think rest is the right response. They wake up in the middle of a stroke, or they don't wake up at all. The correct action, if you experience a sudden and profound unexplained fatigue, particularly alongside any of the other warning signs on this list, is not to rest and see how you feel later. The correct action is to tell someone immediately what you are feeling, note the exact time it began, and seek emergency evaluation without hesitation. If you remember nothing else from this video, remember this: stroke is a time-sensitive emergency in every direction, including the hours before it fully occurs. The treatment window for the most effective interventions is measured in minutes, not days. Every hour of delay in treatment following a stroke results in the death of approximately 120 million neurons and 830 billion synaptic connections. That is not a metaphor. That is the measured biological cost of waiting. The 5 warning signs to burn into your memory right now: sudden vision changes in one or both eyes. A sudden, unfamiliar, severe headache arriving at full intensity without buildup. Sudden one-sided weakness, numbness, or facial drooping. Sudden confusion, difficulty finding words, or trouble understanding speech. And sudden, overwhelming, unexplained fatigue that feels unlike anything familiar. Any one of these alone warrants immediate emergency evaluation. 2 or more together, call 911 right now. Do not drive yourself. Do not wait to see if it passes. Do not take an aspirin and go to bed. Stroke is survivable. Stroke is, in many cases, preventable, but only if you act within the window your body is giving you. Share this video with every person you care about over the age of 50. These warning signs save lives, but only in the hands of people who know them before they need them.